Hello, good afternoon, everyone. My name is Courtney Kesterson. I am the CAHF DPP coordinator, and with us today we have Rich Witerinsky and Jason Belden. And so it's 2 o'clock, so we'll go ahead and get started here. And we will keep an eye on the questions panel today, but we are going to try and do questions at the end of today. And sorry, just making sure that all of our technology is working, doing a sound check here. If anyone else is having any technical difficulties, please leave us a comment in the questions box. And we will go ahead and get started. Just making sure we are all good here. And
everybody's unmuted.
I think so. I think we're good to go. Just wanted to double check there. All right. So Jason, you are the Disaster Preparedness Program Manager.
Sure.
And Rich, can you go ahead and introduce yourself one more time for us, please?
Yes, good afternoon. My name is Rich Witerinsky. I'm the liaison between the CAHF organization and the DRCs.
Excellent. Okay. So today we're going to be recapping some recent events for the LA County EMS agency and their exercise that took place in November. So if you participated in the exercise, this will be a review of how to document your participation, and we're going to talk about an after-action report and improvement plan. So if you haven't already checked out the handouts for today, if you go under the handouts tab, you'll find today's agenda, which is going to have all of the links that you're going to see on the screen in a PDF, so you can actually click them, and some other handouts as well. And so probably the most important one for today is going to be that AAR, or the After Action Report handout. So if you want to pull that up just so you can follow along with us today, that would probably be good. Okay. So again, our objectives for today, we're going to discuss lessons learned from the 2019 statewide medical health exercise. And LA County chose to do an external flooding scenario. That was the statewide scenario, but they customized it to the county, of course. And then we're going to discuss kind of some feedback that came out of the exercise evaluation conference that took place on December 17th. And we had about 20 or 30 long-term care providers join us on that day. So that's going to be, we're going to have some data and some graphs and things. So just know that that's where that feedback's coming from. And then we're going to take a look at a sample after action report and improvement plan, and talk about what are your next steps for that. And then at the very end, we're going to talk about some things coming up in 2020 that you'll need to put on your calendars before our next webinar. So again, if you look at the agenda for today, it's going to have all the same dates that you're going to see on our slides here. Alrighty, so some of you that are rejoining us may have seen this slide before. I updated it a little bit. So if you're new to emergency preparedness, we try to spell out everything as much as possible because it turns into alphabet soup real quick.
Yeah.
But some of the major ones that we're going to be talking about today are the AAR/IP, and that's short for that after action report. The DRCs, those are the disaster resource centers, and so they host meetings and bring together all the different sectors, stakeholders, and do year-round planning leading up to the exercise. So they're kind of starting over now, and Rich attends all those meetings and brings feedback for us. And then let's see here. We're going to talk about the MAC, or the Medical Alert Center, a little bit today as well. So again, you may have seen this picture before, but I always put it in here just to kind of remind everyone kind of the scope of what we're looking at here. We talk a lot about mutual aid, and it's just important to remember that LA County is a very resource-rich area, so you're in a good spot. You have a lot of free resources. LA EMS agency is doing a lot to do outreach. And then of course, we're always here for any of your questions. So just plugging away here. And again, here's a little diagram of where those disaster resource centers actually are. So if you haven't already reached out to your local DRC, you can find all that information in the agenda. If you need help figuring out which one is closest to you or to your facility, you can email me. I know that sometimes people find it more convenient to go to one over the other, but there are actually like jurisdictions. So again, if you don't know yours, just email me after today.
Yeah, we can let you know, but there's going to be a couple times a year where you're going to, that we ask that you participate with the DRCs, and we're going to talk about one of those being the HVAs, or the hazard vulnerability assessment. So it's important for us to prepare those and to provide them to the DRCs that we're assigned to.
Right, exactly. And we are going to talk about that at length later, so that's great. And so, since we're going to be talking about the after action report, I just wanted to take a look back at the objectives that were part of the exercise, or what the exercise was based on. So we've done webinars on this before, so you may have seen these. I kind of condensed it here. And again, these objectives, they'll crop up year after year because these are kind of our core capabilities for building your emergency preparedness program. So if you've been in emergency preparedness for a couple years now, you might kind of realize it's not always the scenario that's important. It's having these core capabilities here, being able to recognize when to activate your EOP, et cetera, et cetera. And when we look at the after action report later, you're going to see how these kind of like plug into that form, and it's already typed out for you. So honestly, I just copy and paste it. But
yeah, it should. We try to do as much of the work, the paperwork for you, without obviously making it individual to your specific facility, but it's not as daunting as it may seem. And once you get into it, you're going to realize, oh, hey, okay, this makes sense. I can do that, no problem. And when we break down these objectives, those objectives are real standard. They're standard across most of the healthcare continuum. The acute care hospitals, when we look at the objectives that they have for exercises, they're a little more granular. They break it down, but they deal with emergency events on a much more frequent basis. So they're diving deeper into their response. And
they've been doing it longer as well.
They've been doing it longer, and we haven't had a requirement prior to 2017. So for us, we're still new at this. But I think in the coming years, what you'll see is we're going to expand on those objectives. And we're going to start including objectives for how you manage it, the disaster, rather than just making sure that you can activate the appropriate policies and procedures. We're going to talk about, incident and action planning and picking the right objectives for your disaster, how to prioritize things and what's important, what's less important, what's not important at all, things like that. So this will get more involved as we go on. And so maybe in 10 years from now, you guys will all be experts and you'll be able to do this with your eyes closed. But we'll work up to adding more objectives next year.
Yeah, and if you have the after action report template pulled up, again, it's under handouts. You can also find this text if you want to just use this language that the county already prepared and put it into your report. You can find it on the LA EMSA webpage. It's just going to be called LTC Objectives under the tab for the 2019 exercise. So again, on the agenda for today, there's a link to the LA EMSA webpage. So we tried to lay it out as easy as possible for everyone today.
Yeah, and most of this stuff is all really good stuff. And let's say for some reason you could not participate in last year's exercise, but you think this exercise would provide value to your staff to be able to work this exercise. There's no saying that you have to do the exercise with another party. It helps because we want to practice that interoperability and that ability to access those resources. But if you just want to do a functional exercise, those objectives, that scenario, all that stuff, you can use it anytime you want. You don't have to, it's not just for, November of 2019. If you want to use it in February, you can.
Right.
So that's the great thing about this is it's created, and whenever you want to do a flooding exercise, you never have to redo any of this because it's all already been created for you. So.
Right. Okay. So we will kind of take a look now at the feedback that came out of the exercise evaluation conference. So in December, the county held an event to get all of the sectors together and talk about how the exercise went for them. So me and Rich were there. We got to talk to a lot of providers, got some good feedback, and then this is some information that we got from LA County as well. Sorry, there we go. So we got the report from ReadyNet about how many facilities logged on and answered the status report and the bed poll. And then they captured about 54 long-term care facilities that participated, which is like
It's a 5,400 or 5,400% increase from last year. Saying as nobody did it last year and 54 facilities did it this year. I mean, we're obviously trending in the right direction. We want to get everybody on ReadyNet. We want it to be second nature for folks, but given our previous experience, I'll take this as a win. But we can do a lot better. And if you guys had, you tried to participate through the ReadyNet website and had trouble logging on, we've got some reports of that. Some of it may be on ReadyNet side. Some of it could be user, forgetting your password and things like that. But I think at least when we see that 54 people participated, we know that at least some people got it. So we'll try to figure out where the disconnect is between the remainder of the 200 facilities that are signed up for ReadyNet that did not participate. And to that extent, I think ReadyNet is offered to do a bunch of free trainings, even trainings in person, which is it's a pretty big deal if you wanted to have them come out and train your staff. I don't know what their capacity is to go out to 400 facilities, but don't be the squeaky wheel. Call them up and say, if you haven't figured it out, call them up and say, I need help using this because it's really going to make a difference for my residents in a disaster. So.
Right, and just to add on to that, we sent out to the facilities in LA County last week a laminated kind of flow chart of how ReadyNet fits into your emergency response. So if you haven't received one yet, hold tight, and because I found some more envelopes that I need to get out. But again, this will be a great tool for training your staff. We sent out a letter as well saying, keep this in an accessible place. But back to the exercise here, if you tried to use ReadyNet on November 21st and you were unable to, I would still, capture that in your after action report because you still tried. And, it's a good reminder that we should be looking at our backup communication as well, because if there is a real disaster, knock on wood, we need to be trying multiple channels. And some facilities were super ambitious and tried ham radios, which was awesome.
Yeah.
But coordinating with the county, I think the county maybe wasn't expecting extra ham radios on there, and so they were conflicting with the hospitals. So that's another kind of area that we're going to have to.
Yeah, those are all great things you want to put in your improvement plan, is to drill down on why that didn't work, and let's figure it out and let's get it fixed for next year.
Yes, and so for the next slide, I have a list of all 54 of those facilities. And so I talked to some people and they said they used ReadyNet, but it still didn't show up in the report. So when I put this next slide up, I'd really like it if you could just check. If you know that you used ReadyNet and you submitted it and you don't see your name there, please shoot us an email so we can make sure that we, like Jason was saying, kind of find out what that disconnect is so that we're better next time.
Yeah.
So
we all want to do better, including us. So we want to support you better next year. We want to do everything we can to make sure that the next exercise is even better.
And so I'll just leave this up for a few seconds here, but I just wanted to say great job to everyone that participated. And, if you have any other questions about this, you can always shoot us an email.
Yeah, we did a little dance when we saw that 54 people had 54 facilities. So, yeah, we were very happy with that. So if you guys managed to do that, thank you very much. It's greatly appreciated. And LA County was really at the point like, hey, how come nobody's answering these things? So at least we've got somewhere to start. And so this will be our floor and we can get better from here.
Yeah, so don't be surprised if I reach out to some of the people at these buildings and say, hey, you did a great job. Would you like to do more work with us? And because you're already, at this point, you're a leader. So, why not cultivate that? But we are also going to look at some graphs that I made, just kind of capturing some of the feedback that Rich and I heard at the exercise evaluation conference last month. So kind of, oops. Next slide, but bear with me. So this animates. So now we're looking at December. Here we go. And so this kind of illustrates what Jason was just saying. So about 20% of the facilities that are on ReadyNet, so the ones that are already signed up, which is about 200, 250. Yeah. So we still have like another 150 facilities that aren't on ReadyNet, but about 20% of the people that are on ReadyNet actually used it for the exercise and got their stuff through. And then I was working with a few other people that didn't have ReadyNet accounts, and they were kind of doing one of those backup methods, emailing their resource requests to the duty officer. We're still waiting to get feedback from the Department Operations Center, or DOC, about how many people submitted their stuff via email. And then that big chunk there are the people that we need to kind of bring in, because at the end of the day, ReadyNet, it's a great tool, but it's only as useful as the data that we're putting into it. So if you're using ReadyNet and you need to evacuate and you need 99 beds, if nobody else is on ReadyNet, it's worthless. So
it's not going to help us. We all need to kind of pitch into that. And so when we say no record of participation, it doesn't mean that they didn't participate in an exercise. They just didn't participate in this portion of it. So, so you may not see your name of your facility on that list. It doesn't mean that you didn't participate in the exercise. It just means in that component. But we want to do better for that next year. So if you didn't see your name on the list, but you did do the exercise, let's get you signed up for ReadyNet. And if you are signed up for ReadyNet, let's figure out why you didn't get the notification, why you didn't respond.
Yeah, or get additional training, or just get whatever password reset, whatever we identify. All right, so here are some kind of recurring themes that I wrote down in my notes from the exercise evaluation conference. Rich Witterinsky and I, we were kind of facilitating at two different roundtables in the larger room with all the other providers as well. So if you didn't get a chance to attend it, I would definitely recommend keeping an eye out for that December 2020, because it's a great way to kind of see how SNFs fit into the larger continuum. And a lot of the other providers definitely plan on working with the SNFs. Like, I know that the hospitals, they write into their plans, at some level they want to, if they're going through an emergency, they want to discharge people to a SNF. And so there's always an opportunity to practice surging in a coalition exercise. So just going along the bottom here, so I based this off of the amount of providers that attended the exercise conference, which was about 27 people. And so pretty much everybody there, because they're already, signed up and kind of plugged in, responded to ReadyNet. And they said that their staff were good at getting the emergency kits out and kind of getting activated there and getting on board. About most of them said that they got out their flood mitigation plans and reviewed them. Some of them realized that their emergency supplies were actually stored in areas that would probably flood if that did actually happen. So some of the after action items that I saw were to find a more secure storage space for their emergency food and water.
And that's not as uncommon as you think. There's entire states that have learned that the hard way by having generators flood during hurricanes and things like that. So
Right.
it's a super common thing that, and we don't, because we don't deal with floods here very often, but if you're subject to it, if flood is on your HVA, and we'll talk about HVAs in a second, but if flood is on there, consider where you're going to keep those the supplies that you're going to use. Are they going to be subject to being damaged by floodwaters? So.
Right. And then pretty much 100% of the people that were at the exercise evaluation conference were on board with activating their EOP and alerting their staff that there was an emergency. Recalling additional staff, that was a strength that I saw. And then a few buildings that I talked to, I think maybe 3 or 4, said that in order to support their staff recall, they set up a daycare area, because in the scenario, roads are getting shut down, schools are getting closed. So in order to bring their staff in, they have to consider all the different things that are going on for their staff as well. So,
and that's a great one. We don't talk about at all. But when you think about it, that could happen in an earthquake, that could happen in a major fire, where we could be islanded for a significant period of time, 3, 4, 5 days. And when you think about your staff that have children, I might be able to get a babysitter for 1 or 2 days, but I might not be able to get it for the entire week. And how are we going to, because we have to have those staff there. Are we going to get other staff from somewhere else? Or are we going to have our own staff come with their families and have an area set up for them?
Right. And so I gave that idea an A+, because it makes me happy when I see people bring that up, because it shows that you're thinking not just outside the box, but you're really comprehending and putting yourself in the shoes of your staff. And
plus, your residents would love it. They would have a ball with it. I really do. I think it's a out of the box great idea.
Rich, did you have any other strengths that you discussed when we were there?
Well, just looking at your exercise strength graph, it's very gratifying to see that people have done things like activated the EOP and alerted staff and responded to ReadyNet. I mean, it really is. But besides that, I mean, there's always room for improvement. This is a new year, time to dust off some new goals and move forward in regards to that entire process. But again, I see over to the right that the small thing is set up daycare facilities. I would also include the fact that not only daycare, but they should have animal care in that area.
Yeah, that's a great one too. And we don't touch on that often enough as well.
Yeah.
Nobody's going to leave without Fido, I can tell you that.
Yeah.
Okay, well, on that note, let's take a look at the other side of the coin. So areas for improvement. So a lot of the people that were at the exercise evaluation conference, they're leading the pack. They did a great job, but a lot of them identified that, like Rich was saying, there is always room for improvement. So one of the more popular themes we saw was training more staff on ReadyNet, and then practice a backup method of contacting the MOOC. So particularly for the people that had trouble using ReadyNet, having that phone number or email or fax number, or if you keep going down the hierarchy, 800 megahertz phone, ham radio, smoke signals. But that's a good thing to practice, because in the exercise, the website crashed because there were so many people trying to get on it, which it's a learning experience for everyone. So and then about 20 of the providers mentioned improving staff recall responses. So you could have a great staff recall plan, but if the staff don't respond because they're not kind of plugged into your emergency response and they haven't practiced it and taken ownership of it, you might get mixed results in a real emergency.
Yeah, and when you look at that, I think both Courtney and I, or all of us, would love to find out what your guys' creative methods are to get staff to come in. When you think about folks doing overtime and stuff like that, what is there a carrot that you guys use? Is there kind of some something to encourage people to come in? And
We've heard of people kind of stratifying their staff, so they have kind of like an A team and a B team of like people that live in the immediate area. So if there are road closures, you have kind of a short list of people that might be able to, we've seen in some disaster areas that the staff had to bike in. When the mudslides happened in Santa Barbara, they were literally using boats to get people in. So that's a whole other conversation. But also, so again, the next column, training more staff on the activation of the EOP. So some of the feedback that we saw was that the staff didn't know where the EOP binder was. They didn't know that there was like a rapid response section that they could go straight to. So that kind of ties in with the first column there, just training your staff.
Yeah, and that's one of those things. That's a layup deficiency if a surveyor asks them the same question. So you definitely, if you got staff answering the question like, I don't know where the plan is, that's yeah, for sure. We want to coach those folks up and let them know where it is and how to get the quick response stuff. So.
Right.
Jason, may I interrupt? But the surveyors are becoming more sophisticated, and one of the things they're asking the staff members, whether they be housekeeping, laundry, dietary, nursing, etc., but they're asking what specific roles they play. So they have to know their roles immediately. And so from that perspective, the EOP is an incredibly important document.
Yeah, and it, when I hear stuff like that, and Rich, you're absolutely right. In my experience in the last 2 years of talking to surveyors, that their level of knowledge about the rule and about, even more importantly, about how response actually works in a disaster, they're asking poignant questions that will make a difference in how you respond during a disaster. And it's in some ways that's good. In some ways it makes them think like they're the only ones that know that, and that's not always the case. And so, but if you've got folks that can't answer that question, it's an easy deficiency. And if you get a surveyor asking for roles and responsibilities, I think that's a little bit broad. I don't think the rule actually applies to that, but or discusses that specifically. But it does ask that the leadership all be defined, and that being in writing, and those folks need to know about it. I can't remember the tag number, but it's most closely associated with incident command. And so if you guys are doing NICS or a version of NICS in your building, HICS, something like that, then those folks would be pre-assigned to a specific role within the NICS structure, and then you could answer that question pretty easily. So
right, and we'll talk a little bit more about NICS at the very end of the PowerPoint. But just moving along here, because I do want to leave enough time to get to people's questions at the end. So just these last couple columns here, the second to last one, moving supplies away from potential flood areas. That's kind of like the answer, the action item to the last slide we saw of identifying, dusting off your flood mitigation plans, all that good stuff. And then that tiny column there, a handful of people said that they hadn't really considered a good area for their command center. So if you do decide to, and we do highly recommend that you use incident command, what Jason was just describing, you're going to want to think about a command center where you can have a computer hooked up to a red plug, so you can have ReadyNet open if your power goes off, and you can keep communications with your county EMS and all the different stakeholders that you need to talk to. And if you want to learn more about that, I think we have a training video where we talk a little bit about having a command center, and that's available on CAHF's YouTube channel.
Yeah, and I think most of you guys probably have an area that you would call your command center, or where you would, do your operations from during a disaster. That's what we're talking about.
But also, just another note on that though is if your command center is in your business office and that's locked at night, your night staff isn't going to be able to access all of your materials. Yeah. So it does take a little bit of consideration. I think we have a checklist on our website of some different considerations to put into that. Okay, so just to summarize the exercise evaluation conference, and Rich, you can jump in at any time here. But our first bullet, I just wanted to say, like we said earlier, great improvement in participation and just the general comprehension. I started here when the rule first came out, so I feel like I've been growing along with all of you guys. So it's been really great to see so many people over last year and the year before getting involved. Again, we should take a look at what our backup communication methods are besides ReadyNet. So if you got one of those laminated charts that we mailed out, it's got some more information on there about some of the backup methods. If you haven't gotten yours yet, just hold tight, it should be out by the end of the week. And then we got some really good feedback from some administrators who have done the exercises before, and so this time around they put somebody else in charge and they were just the observer, and I heard it was a very interesting experience, and
Yep.
they might change things up next time, because when you get somebody in charge and they have to start directing other people under stress, sometimes some people's personalities aren't suited to that, and that's nobody's fault. You just move on, and
That's why we practice.
that's why I practice. Yep.
We want to get it wrong in practice and not wrong when it's actually important. And this is a great lesson. I think every administrator should try during their exercises, because you're only in the building 1/3 of the day. So 2/3 of the day, if the disaster happens, you're not there. And how are those folks are going to deal with the stress of managing a disaster and emergency?
Let's see, that fourth bullet point there. So facilities, getting creative with their exercises. So going back to that childcare idea, some of the administrators in attendance were telling me about the different apps that they use to recall their staff. And so, we live in the era of apps, and so you have a million choices. I'm sure there's free ones out there, but whatever works best for you and your team. I personally think that WhatsApp is really good because you can message from a desktop and from your phone. So if you have stuff on your network or in your EOP and you just want to like copy and paste it and then blast it out to your entire staff, WhatsApp is free and you can do that. But again, there's Everbridge, there's literally 1,000 choices. And then using social media, because part of responding to an emergency is also informing family members, at least of the status of your operations. Obviously still respecting, HIPAA rights for all your residents and protecting your business interests from, the news, but
social media can be
double-edged sword.
Yeah,
of course.
but it can be effective, especially after you've lost. Let's say you've lost your landline communication, or maybe you've lost power, and the only way that you can call out is by cell phone, or maybe you're evacuating. Maybe the only way that you can get a message to the family members while you're going through the first part is to post an update on your social media page, whether it's your Facebook page or Instagram or Twitter or whatever it is.
And let's see, I saw a few of the administrators talk about bringing in volunteers to help out with the exercises, but also working on the volunteer management requirement under the EP rule. So we kind of touch on this every once in a while, but just to remind everybody, you have to have a plan for volunteer management, because if the power goes off in your neighborhood and your building is the only one with an emergency generator and the lights are on, people are going to show up. Sometimes family members show up wanting to help. And so, if you want to get people involved, then you need to have some kind of process for that. And we have a few sample policies on our website under the Emergency Operations Plan webpage. So you'll have to scroll all the way down. This is kind of where we've been adding extra stuff for your EOP binder. But I think that's a great idea. And then also, for your exercises, it'll kind of maybe free up some of your staff that could really benefit from being involved in the exercise. And then lastly here, we got some feedback about the nursing home ICS or NICS materials, just making those more user-friendly so it's easier for your staff to kind of jump in. especially if they're new to the whole thing. So that's going to be something we're going to be discussing kind of internally here, because we put out those materials, and we're always open to feedback.
Yeah, 100%.
And Rich, did you have anything else you would like to add?
Yeah, two things. Number one, let's not forget the resident council. They should know that a disaster plan is in place. They should be privy to it. The residents should be as well. And then if you have family members that come in. So I remember it used to drive me nuts that you'd have family members come in periodically and you'd meet with them. And the issue was, well, you know, this is what's happening. This is what's happening. It would be an ideal time on at least a yearly basis to dust off the emergency operation plan with family members so that they feel that the services that are being provided are for my parents, you know, this is that we're prepared.
Yeah, absolutely. I think that's actually a really great point. Emergency preparedness is a great way to, you know, show potential clients that you've got your stuff together. And, you know, if you want to, I think I have a slide in here somewhere about it, but like taking photos of your exercises is also a great way to kind of like build up your team, your staff as well, and get them excited and interested.
Yeah, I mean, we hate to think of it as a sales tool, but I definitely, if I'm thinking about it as placing my mom or dad in a facility, and a facility stands out by how prepared they seem to be, well, it's definitely going to make a difference between who I would choose. Now, not everybody is like that, but I do think there is an aspect to that makes you appear more professional. Definitely, you're prepared to deal with all the things that can happen to mom or dad.
And yeah, we don't talk about this often enough, but if you are having to go to your executive leadership and you're still trying to get them on board with your emergency planning, bring that up to them and say, this is a way to stand out. This emergency preparedness equals business continuity, and really, you know, hammer that home for them, or just turn on the news. But
yeah,
right.
Because it can go really bad if you don't handle a disaster well. It can go very, very poorly. So.
Rich, do you have any other thoughts on the evaluation conference before we move on to the after action report?
On it, I just wanted to input that I watch the news on a daily basis, as I'm sure many people, if not all of the people on board the phone call here, do as well. And we've been seeing this terrible thing that's happened in Puerto Rico. And there are pictures of entire blocks being leveled. And literally, we are expecting that same type of an activity in the event of a bad earthquake comes into our area. And you know, we've had them in the past. It's going to happen. And I think that as far as HVAs are concerned, it's something that we should probably have at the very top. But again, this is something that we have to prepare for in the extreme. I mean, nothing is off the table. If employees come up with ideas, congratulate them, reward them. In October, we had the California shakeout. One of the DRCs that I go to, they actually filmed it. And then what they did was they asked the staff, a group of people, to judge which person, I don't know, provided the best care, the best emergency response, and then they gave them some type of a gift. So there's a creative way of doing this with our staff as well.
Right. And honestly, compared to other really expensive things that facilities try to get to stand out, emergency preparedness is relatively cheap, to be honest. Just get some safety vests and some clipboards and you're already head and shoulders above other people. So anyway, enough about that, but excellent point. Thank you, Rich. Okay, so you did your exercise. You are ready to do your after action report. So we're here today. It's the 8th. Just everyone should know these are due on the 21st, and the county is not going to take any late entries, and you do have to turn in this report if you want to get the certificate of participation from the county, which is kind of like, you know, your golden ticket. So if you complete it and you want me to look over it, I'm happy to do that. If I get 100 of them from after today, I'll have to, you know, but hopefully, you know, it's pretty simple. After we get through this today, I'm pretty confident that everyone should be able to do one yourself. So So again, if you look under the handouts for today, there should be an AAR template, and it has the email that you need to submit it to on the bottom. So this is the template for 2019 that they put out. So if you have one that doesn't have that email, it's just an earlier version. You can still use it, just the LA County version, and then we send it to Lori Lee Brown at LA County EMS Agency. So if you did not participate in the exercise and you're on the call with us today, just know that you won't really get anything out of submitting an AAR because they'll just cross-reference it to whoever they saw participate on the 21st in November. But this is still valuable because you need to do an after-action report for every annual emergency exercise or real-world emergency that you go through and want to substitute your exercise with. And then this last note here in red, this is directly from LA County EMS Agency. They want to see, completing it, the report means having at least 3 things in each area, which is, I think we can do that.
Yeah, for sure. The 3 things, guys, we can make it as easy or as difficult as you want. And you can break down each thing into multiple tasks in order to complete the improvement plan, or it could just be one thing. But when you see a written one, we're going to show you an example of just a basic one. You can see it's not very difficult for you.
Right. So what tools are we going to use right now? I think I already said this like 10 times, but we're going to use this after action report that you should be able to find under handouts. This other screen cap here is just an example of a participant feedback form. LA County has their own version. It's kind of, pretty simple. So ideally, after you have completed your exercise, you want to do a debrief or hot wash with your staff that participated. And get their feedback, use this form, and then also get a sign-in sheet. If you forgot to do that or didn't know that you were supposed to do that, just go ahead and do it, I guess.
Well,
Try and track down those people that participated.
For sure. And then on that participant evaluation form, what we're really trying to capture is we're capturing those 3 ups and those 3 downs. We're just capturing it from each individual participant so that we can see, because somebody may say, this worked great, and somebody else may say it didn't work as well as we wanted it to. And so you, as the controller of the exercise, you'll be able to collate all that information and hopefully come up with a list of 3 things that you want to that you did well and 3 that you want to change.
Right, but I also just want to point out that the participant feedback forms and the sign-in sheet are part of fulfilling the e-tag for your staff training and staff testing. So you don't want to do all this work and then get caught up on that little tiny thing. So, and then always the sooner the better after the exercise is done. And then this other screen cap here that says long-term care objectives. So we kind of went in depth on objectives before, but like I was saying in the earlier slides, you can literally just take the objectives and plug them into this column here that we will take a better look at in just a second. So if you joined our last webinar, you may have seen that we have been going kind of step by step through the planning process. And so last time we left off at actually conducting the exercise. So again, we have a little picture here of one way to do it. You can use vests, however you like. And again, this is a picture of a functional or full scale exercise. If you're doing a tabletop, then that's when you're sitting around at a table and discussing it. The difference with functional and full scale is that you're walking through it. For full scale, you're interacting with outside agencies or other nursing homes, etc. And so I kind of just put this in here for reference. And then here's kind of the next step, like I just said, was the hot wash and debrief.
And just so you know, if you missed that stuff or you didn't get everybody to fill out a participant feedback form, you can go back and have them do that. It's, I mean, obviously we want to do it right after the exercise, so the information is fresh in our minds, and we're all in the same room. But if you have forgotten to do that, by all means, you can go back and complete that now. You're going to need to develop the 3 ups and 3 downs that you want to send to the counties.
Okay, so now documentation. So this is like the exact outline of what's required for your after action report. So, what went well, et cetera, et cetera. I think we've kind of covered that. So again, here's the template that you can find under handouts, and we're going to look at a sample one. And we've kind of just redacted the name and address, but I thought that they did a great job, so we are going to take a look at it. So here we have the first section, and so you can see that they just copied and pasted the objectives that were provided by the county, which is totally fine. And then I think these columns are intended where you can just put like P, S, U, whatever, but I liked that they just put a short note in there instead. And I think it makes it more valuable because you can see what their actual response was. And so let's see, we'll kind of go through here. So as you can see, it's totally fine to capture if you struggled with something. You're not going to get a deficiency for, being honest in your after action report.
Yeah.
Unless, somebody passed away. But...
Right. Well, there's approximately 45% of the buildings, the skilled nursing facilities in the state have received a deficiency for the exercise requirements in the last year. So we know folks are struggling with the paperwork portion of it. It's not the participation. So what we do is we go and review not all of them, there's hundreds of them, but I try to read 15 or 20 different 2567s so that I can get an idea of what within those requirements each person is struggling with. And without fail, all of them had to do with the paperwork. They weren't that they didn't participate, it's that they didn't capture it with an after action report. They couldn't prove who they talked to at the county. It's all these other things that go with it rather than you actually participating. So this is the part that's going to save you from getting that deficiency next time.
Right. And I just wanted to point one thing out about this facility's answer here. So for Objective 5, they mentioned the 1135 waiver process, which I thought was really great, even though that they put it in that column. But having the 1135 waiver process shows really great comprehension of the whole situation.
Yeah, and that Objective 5 is an objective that they wrote. They wrote their own objective there, which is pretty cool. So like we said, we developed those objectives to be kind of a standard thing, the baseline that we want you guys to do. This particular provider chose to create their own objective on something that they thought they might like to practice. Now, it turns out they didn't practice it at all, but at least, they thought outside the box. They thought, well, maybe let's try this as well. And you're more than welcome to do that. You don't have to stick with our objectives.
Right. So if you remember from the earlier slide, there were only 5 objectives that the county prepared, and this facility actually did 7. So the Objective 5 that we were just talking about was one that they created. And then Objective 6, they are kind of looking at their volunteer management policy, which is really great. And then Objective 7 was kind of a new...
That's behavioral health.
Yeah, so that's one from the county, but for basically all exercises moving forward, there's going to be some element of behavioral health. So in response to that, our program, we put out a video about psychological first aid. If you kind of encounter that and you don't really know how to address that or how to incorporate it into your staff training, you can check out our website. We have a webpage for psychological first aid.
And the county, Los Angeles County has, I don't want to say unlimited resources when it comes to that, but they have resources available to assist us in a disaster and emergency. They have folks that can come out and help. And then there's things like your employee assistance programs that you may leverage. Most of those things come in the days or weeks after the disaster. And generally when we're doing these exercises, we're exercising the first 4 hours of the event. And it makes it hard for us to tap into those resources. But just know that those resources do exist. The county is available and able to help for that. So if you had something like an active shooter event or something where your staff or residents were subjected to something like that, it would be really important to have that on your Rolodex to get a hold of those folks.
Right. Okay, so we have a couple more slides.
Did I date myself with the Rolodex reference?
Yes, but we'll let it go.
Okay.
Okay, so it's already 2:50, so excuse me if I kind of go through this too quickly, but we will do our best here. So again, you can see the next page of the template. You've got those 3 strengths and at least 3 areas for improvement. So again, you can pull this right out of the stuff that you wrote on the first page, and then areas for improvement go right into the improvement plan right below. An improvement plan, you know, you're just breaking it down into actual action items and then assigning it to a person or a role, and then giving yourself a date to complete it by.
Yeah, and if you've got 10 things you want to improve, try to prioritize them into what's going to have the most effect on resident care. So if you had something that could potentially cause an injury or cause somebody be subject to that, those are the things we want to prioritize. And if you get to the end and you go, you know, I didn't know how to use the 1135 waiver process, and that's number 4 on your list, it's not as big a deal. You know what I mean? We tell you to do 3 because 3 good improvement items may take you 2 months to complete. If you have to rewrite something or do a new policy and procedure, all that stuff could take time to do. So we want you to prioritize the list of what you do in terms of improvements based on how it would affect patient care first, and then kind of go down from there. Like, would it affect our staff? Would it affect our reputation? Would it affect us financially? Kind of that level of prioritization that we use during incident command. You would use the same kind of thought process to develop your improvement plan. So pick the things that are most impactful to patient care and work your way down from there.
Right, but you also need to balance it with the fact that you have to do it within 60 days.
Yeah.
So you can see some of these items that they put here are really specific. Like literally one of the things they did was purchase tents, and you know, then you can check that off your list and you're in the clear. Sorry, Rich, go ahead.
No, that's quite all right. One of the things that I wanted to do was to also direct people to step back one step further. So when you're doing new employee training, you incorporate disaster preparedness into your new employee training. Many times people don't think of these things, and so you're, providing it to them. And it's when they step in the door, besides all of the rest of the checklists that they have to address, disaster should be one of the things too.
Yeah, I mean, I know it's really difficult for us because we don't have time and bandwidth to do this. But if we tried to just look at what the hospitals do when they train their staff on this, they train them on E-teams, and they're assigned to a specific function within the hospital incident command, and that's all that we need to train them on. So if we decide to do that as a facility, you could say, every CNA is going to be in the resident services branch, and every housekeeping staff is going to be in the infrastructure branch, and every dietitian or a dietary service worker is going to be in logistics, or whatever the case is. We could predefine that beforehand, and we could just really minimize our level of having to develop training stuff because this stuff is already created for them. So it's a great point, Rich.
Mm-hmm.
Okay, so just to wrap that up, and I see that we have some questions, so just give me a minute and then we will take a look. So again, for your improvement plan, give yourself 60 days to complete your action items. You need to assign it to a specific person. And then, let's see, oh yeah, the second bullet point. So if you do make changes to your EOP, just start a log of the changes that you make, because a lot of the E-tags, they have this little blurb in the interpretive guidance that says that you have to have annual updates to that, and that trips up a lot of people as well.
Yeah.
And a lot of times you've done the updates, but it just wasn't captured in a formal way. So even if it's just a running log of what page you edited on what date, that'll help hugely. And then last point, so you have 60 days to complete the after action report after the exercise. So January 21st, 2 months after the exercise, and then keep 3 years worth of the AARs for survey time. Okay. So we already kind of talked about all this with the sign-in sheets and the participant feedback forms. If you want to go see the situation manual, which is the entire document from LA County that has the objectives and the master sequence or scenario events list, the measle, all that stuff, you can find it on LAMSA's website under the tab for 2019 exercise. Also, when I put this video up on YouTube, there will be a Dropbox links in the description, and it'll have the situation manual and all that good stuff in there, just to make it easy. And then if anybody took pictures of their exercise, this year we are trying to gather a bunch of photos, because for our next disaster preparedness conference, I really want to do kind of like a poster exhibition, and just give everybody a chance to show all of the fun stuff that you and your staff get up to.
Yeah.
And so if you have vests, that's a great way to show it off. And kind of like we were talking about earlier is, it's great for your public image as well. Alrighty, so we're going to talk for like 2 minutes, maybe less, about the upcoming HVA meetings. So Jason mentioned at the beginning of the webinar, when you're reaching out to your disaster resource centers, there's kind of 2 meetings per year that they want everybody there. So in the beginning of the year and then at the end. So in the beginning, they talk about the hazard vulnerability assessments for 2020. And so these are all coming up really quickly. So if you...
Yeah, so what we want each one of you guys to do, so this is a requirement that you have to do this annual update to your hazard vulnerability assessment. If you've not had a disaster at your facility in an emergency that could change that, change what you consider the appropriate risk. Let's say you didn't have internal flooding on your thing, but you've had 2 pipes burst this year and you've had to partially evacuate 2 resident rooms or something like that, that would cause the hazard vulnerability assessment to change slightly. It doesn't mean that you have to change it every year. It just means that you have to review it every year in light of the events that have happened to you in the last year. And has things happened in the community that would make you think, well, we're more likely to be subject to utility failures. I'm in SoCal Edison district, and I think I might get my power shut off. So now utility failure is going to go up on your HVA. But let's say nothing changed. It's completely okay for you to say these are the risks that we saw last year. We don't think there's anything that's changed based on new evidence, and you're going to submit that to those folks at your DRC. The DRC is going to collect that from everybody, and they're going to come out with a coalition HVA, and that's going to be your 2-pronged approach to providing this to licensing. So licensing is going to ask for the community HVA, and they're going to ask for your HVA. And so you need to have both of them in order to meet that requirement by the regulation. So,
which is ETAG 9.
Yeah, and it's a super common deficiency. Yep. And once again, it's not that you're not doing it, or that you're doing it incorrectly. It's that we're just not keeping good track of the record keeping.
So if you don't know which DRC you're assigned to, please email me, and I can help you out with that. And
can I make a couple announcements before? I don't want to end before I forget about the mailer. So either last week or this week, every facility in Los Angeles County should get a laminated contact card, and it's going to have information for how to log into ReadyNet, how to contact the county. It's also phone numbers for people within the county that would be tasked with doing emergency response for our healthcare segment. These are incredibly important phone numbers. This should be plastered closest to the phone that's manned 24 hours a day. Everybody should be trained on how to use this in case you're not in the building. It's really important. It costs us a lot of money to have these things laminated and printed. So I want you guys to understand how important those contact informations are, especially for your staff who don't do this at all, or maybe they think about emergency preparedness once a month. For those people, it's really, really important to have something quick that they can reference on how to get a hold of help if they can't get a hold of you. So it's great stuff. We're doing a NICS training. We've referenced Nursing Home Incident Command System a number of times throughout this training. I think as we adapt and evolve to getting the smaller scale of our buildings using incident command, I think we've learned a lot as trainers. We presented this in October of last year in Glendale, I believe, and then we're going to do 2 more sessions, one in Fresno and one in Anaheim. Both are free to attend. Certainly, I don't think anybody from Los Angeles is going to drive up to Fresno, but if you want to drive down to Anaheim, it's going to be at the Embassy Suites.
Anaheim South.
Anaheim South, so the one that's on the same road as Disneyland or whatever. But it's big room. We'll have
lunch and 5 hours of free continuing education.
Yeah. And you guys are hearing this first before most of the rest of the state. So
because the registration link just went up today, so I added it.
Yeah, so you guys, you got first crack at it. If you want, we're going to be presenting the same information from October with some slight modifications. But I think it's a wonderful program, and it's free, so that's always helps.
Right. So if you want to register, again, the link is in the agenda from today, and I think you might have to make a CAHF.org account, but it's free to do that. So we hope to see you all there. And then going back to ReadyNet really quickly, they have been opening up some more training opportunities for us. So links to that in the agenda as well. And did you want to say something, Jason?
Yeah, one more thing. I totally forgot about this, but we mentioned it on our last call. Over the last 6-7 months, we've hired a company to contact each facility in Los Angeles County to ask them about their emergency power capacity at each building. So if you've got a call from somebody that says they're calling on behalf of Los Angeles County EMS, and they will have specific questions about your generator, how much fuel does it do you have on site? How long can that fuel last? You know, things like that. It's a very basic kind of questionnaire, but it may only be able to be answered by your administrator or your facilities staff. Those folks are not, it's not some weird thing. This is really the federal government really trying to get a hold on what would happen if we have a catastrophic loss of utilities. And we just don't know. We don't have a good idea of the capacity of each building. We know what the minimum requirements are. And if everybody has the minimum requirements during a disaster, we're going to be in big trouble. Right. Now, I don't think everybody does. I think people are well above the minimum requirement, but we just don't know. And it helps us for planning purposes. If we can figure out, I'm going to have to bring a generator to this person because they've got 16 subacute vent patients, and their generators all tied up on those vent patients. So it's little things like that will help us kind of plan for the future. But if you get the call, it's not a fake. It's not somebody trying to gather information from you. It's somebody calling on our behalf.
Okay. So let's see. We are going to go to questions now. So thank you everyone that is bearing with us here. Let me just get the questions panel pulled up, and let's see. So we have one question. Where did you say we can locate the information for the EOP? And that's going to be on our website, cafdisasterprep.com/EOP. We'll take you right to that webpage. And then if you scroll down to the bottom, that's where we have those extra policies and procedures for volunteer management, and also the 1135 waiver stuff that we've been talking about. And it looks like that was our only question. So I'm gonna hang out for a few more minutes just in case anybody thinks of anything else. But again, if you want a CE hour for today's webinar, you'll need to complete the evaluation that's also under handouts, and then email it to me, and then we will email back your CE certificate. And we hope to see you next time. Our next webinar is on March 11th. We haven't nailed down a Haven't nailed down a topic yet, but it might be about utility failure.
Yeah, we have Eric. The county, Los Angeles County, has hired a company called Powered for Patients based in Washington, D.C., and we're working with them to do the emergency power surveys. We also plan to meet with SoCal Edison and as well as kind of the fuel providers for the Los Angeles County area. As we look at people's plans, we see that many providers have the same companies listed. And so we're going to try to figure out what, kind of where, if 50 people all need diesel fuel, how do we prioritize who gets what and when? And so we're working with Eric to kind of determine that for the county. And then maybe we'll have him present on something like that at the next webinar. And he's happy to come do it for us.
And also, if you ever have any suggestions on topics you'd like to see, we spend a lot of time doing planning and preparedness for the annual exercise, but March and May, we usually have guest speakers on, so we're hoping to do that again, or any topics that people really want to see. We had one more question come up. Where do we locate the participant evaluation form? So if you go onto LAMSA's webpage with that link that's on the agenda, and you go under the tab for the 2019 exercise, if you scroll all the way to the bottom, there should be some links there, and one of them is the participant evaluation form. I think I may have already put it in the Dropbox as well. I sent that link out in the email that went out to everyone an hour before the webinar, and then it's going to be attached to the YouTube video as well. You don't have to use the LAEMS one. We have some more generic ones on our website as well under exercises. Alrighty, so I don't see any more questions. Let's see. We have one more. Where do we get the community HVA? So that's why you want to go to those meetings. That meeting is where you can get the community HVA, get on the mailing list for your DRC coordinator, and they'll get you updated.
Yeah, but before you get that community one, we have to submit ours to them so that they can use it as a basis to build the community.
Right, so if you haven't done an HVA before, you can find the Kaiser template on our website, cahfdisasterprep.com/HVA. And then you'll just need to make sure there's going to be some like hospital stuff on there because it's Kaiser.
Yeah, and you can probably email your DRC rep and get last year's, and then you can use that to help you build your own. That'll give you some indication of what other people are viewing as the most likely risks. If you're not an emergency manager or worked in emergency management, some of this stuff you may not realize how to score that. There's a little, kind of a cheat sheet on the Kaiser one, but it's really open to interpretation, and that's why I say it'd be great if you could get last year's from the DRC coordinator so that you can kind of get an idea of earthquake. Okay, I know it's going to be bad, but how bad is it going to be?
Right.
And how, if it only happens once every 50 years, does it have to be higher on my list? Because it has the opportunity for a greater loss of life, then it has a higher priority. Whereas, loss of power, if you don't have a subacute or people on vents, it may not represent much of a risk to life safety, but it's certainly more likely to happen a few times a year. So it's weighing that out. Talk to the DRC coordinator. They can give you an idea of how to fill that out. And if you still have questions, both Courtney or myself can walk you through how to fill it out as well.
Right. And also when you go to do your HVA for your own building, we really recommend Googling Cal OES My Hazards. So again, that's Cal OES My Hazards. And you can type in your address of your facility and it will pull up a Google map kind of thing for you, and it'll show you earthquake faults, floodplains, wildfire risk, and it's actually a pretty fun tool.
And it gives you a list of how is your home or is your facility sitting on ground that's subject to liquefaction? Meaning it was landfilled in there, or are you on bedrock? Things like that. You would never know that, but if you put your address in that website, it'll tell you exactly.
Yeah, and if you do go on that, honestly, just print out that report and save it for your records, because then you want to just bury the surveyor in your research and,
Yes.
can't go wrong there. So again, I'm going to hang out for a couple more minutes if anyone else has any more questions, but thank you everyone for joining us.
Thank you, and Happy New Year to everybody. Let's
Happy
make
New Year.
2020 awesome.
Yes, and be safe out there. Thank you. Hey Sergio, so I'm not sure if Lori is going to email a response back before the deadline. If you are looking for like feedback, then you can email it to me and I can give you some feedback on it. But right now she's kind of just collecting them. If you want, I can reach out to her. But yeah, why don't you shoot me an email or give me a call? Okay, great. I'll follow up with you after. I'm not at my desk right now, so don't call me right now. Okay. Thanks, you too. So the website for the hazards, that's My Hazards, Cal OES. So one more time, if you Google My Hazards, Cal OES, that'll take you to that webpage where you can get those kind of GIS maps of where the earthquake faults are and stuff. I did my own house, I was kind of scared. Okay, so if anyone has any more questions, you can email either of us anytime. I tend to be the lead on the LA County stuff, so if you send it to me, I will answer you as soon as I can. Again, send me your CE evaluations within 30 days if you want a CE hour for today's webinar. I think I'm gonna sign off now and wrap it up, but I'll send out an email with the YouTube link when I get this uploaded, and then you'll be able to access the handouts through a Dropbox link on the YouTube video. Okay, so once again, thank you everyone for joining us, and have a great January. May all of your resolutions go well, and I'll see you next time.